Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Welcome to the Cardinal Minute. I'm Dr. Jennifer Koch, Vice Chair for Faculty Affairs and Education in the Department of Medicine at University of Louisville, and I am pleased to introduce our chair, Dr. Kim Williams, who also served as our first Grand Round speaker of the academic year. Dr. Williams, would you like to share with us what we covered in our Grand Rounds?
Well, thank you, Dr. Cook. It was my pleasure to introduce the topic. I know that folks are expecting from the chair to just get an update from the department, but I thought we would do something a little different and talk about future directions. And the topic was really about AI, that is artificial intelligence, and is it something that's going to help us or replace us? The bottom line of what we were trying to talk about was the fact that medical knowledge is said to double every 73 days. And every time we don't keep up with the latest in evidence, it's putting both our patients and our physicians in our system at risk. AI actually has the capacity to bring volumes of data into the clinical scenario, and we can envision widespread adoption of AI in all of the cognitive specialties where this wide range of knowledge and knowledge growth can be implemented. For example, through electronic health record prompts. And I know there's going to be some prompt fatigue with that, but folks will get used to the practice patterns and that fatigue will go away. And hopefully this will lead to better patient outcomes. Now, obviously, this wealth of data has to be tempered by the clinical experience, the fact-checking, and the compassion and personalization that a physician will bring to that doctor-patient relationship. And so in the future, we were expecting that these unique aspects of humanity as physicians can be emulated, if not completely reproduced, by an increasingly emotionally intelligent programming with artificial intelligence, but we're not quite there yet. Until that happens, we are armed with a wealth of knowledge, and it can really help us. And we're hoping that we can actually use AI to help us make sure that our patients are getting absolutely the best care possible.
Great. Thank you, Dr. Williams, for kicking off the academic year with such an interesting topic. And we will see everyone next time on the Cardinal Minute.